It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. Welcome to a new episode of Morton in the Morning. I'm your host, Julie, and we are broadcasting right here from Morton Hospital, your community hospital in Taunton. We hope everyone had a wonderful Easter holiday and holiday weekend. It's so nice to once again see the weather starting to get a little bit warmer outside. This week at Morton, we have a couple of recognition weeks that we are celebrating. So before we get into our show, I'll highlight those. First, it is Cancer Registrars Week. So we have an amazing cancer registrar who works here at Morton Hospital in our medical records department. So thank you to our registrar, Linda, for all you do. And it's also Patient Access Week. So that's actually a much larger team. We have quite a large patient access team here at the hospital, and they are responsible for patient registration, admitting patients, and so much more. So we want to thank them for all that they do for our hospital and for our patients. They're often right at the front doors, the first people you see when you come into our emergency department or if you have to be admitted to our hospital. So two great teams there, and we want to thank them for all that they do as we celebrate their special weeks here at Morton Hospital. So, because we have some great content today, let's get right into today's show. So for today's show, we are here with Dr. Zach Kramer, who is the Associate Chief of Emergency Medicine here at Morton Hospital, and he's here to talk to us all about the topic of stroke. So very important topic, a lot of great education we're going to provide today. So first, let's start with having you tell us a bit about yourself.
Absolutely. Hi, guys. My name is Zach Kramer. As she said, I'm the Associate Chief of Emergency Medicine at Morton Hospital. I also sit as chair of the Stroke Committee. One of the many hats that I wear, and in addition to being an emergency physician, I do have a strong love for the emergent treatment of acute stroke.
Excellent. So you mentioned the Stroke Committee and that you chair that committee.
Mm-hmm.
Talk a little bit about who's on that committee and what the committee actually does.
Absolutely. So we have a great stroke committee and stroke program here at Morton Hospital. It's made up of myself, which is the emergency physician side. We have the technician side, the CT technicians. We have radiology involved, neurology involved, quality control. We got a whole group of different individuals all come together to make up this committee. And pretty much the main thing that we do is to make sure that Morton Hospital continues to be a leader in stroke management and care by pretty much monitoring our treatment of stroke patients and to make sure that we adhere to the strictest and highest level of stroke treatment and guidance per the state, national level, and the AHA guidelines.
Okay, excellent. So how often would you say that we do care for stroke patients here at the hospital?
Stroke is extremely common diagnosis in the United States. There is a stroke happening about every 10 minutes or so. Mm-hmm. Daily, we probably see 1 to 2 strokes at our facility.
Okay. All right. Now, medically speaking, let's go back to the basics. So what exactly is a stroke?
So, great question. There are 2 broad categories of stroke. Okay. The first category is the hemorrhagic stroke. That is pretty much blood in your brain. Okay. And that can be caused by a number of factors. An aneurysm in your brain. Mm-hmm. Hypertension can cause a bleed in your brain. And then the more common is the ischemic stroke, and that's a stroke that people generally are more accustomed to hear about and see and think about when they hear the word stroke. Okay. About 20% of all strokes are hemorrhagic, and 80% are all ischemic. And ischemic pretty much just means you have too little blood flow to the brain. So your brain's not getting adequate oxygen or nutrients, and parts of your brain actually start to die.
Okay, interesting. Now, the other one that's only 20%, you said that's blood in the brain. What causes that? Is that like a blood clot that moves into the brain? Or?
Nope. So blood clots, well, I can break it down a little more. So so with hemorrhagic strokes, usually the most common cause of a hemorrhagic stroke or blood in your brain is that an artery explodes, is the best way to explain it. And that would be like an aneurysm. Okay. Or untreated blood pressure over long periods of time can cause that as well.
Interesting.
The other type of stroke, the ischemic stroke, as I said, not enough blood flow to the brain, can be caused by three main factors. The first being a thrombus, which would be a blood clot, forms in one of the arteries of the brain, stopping blood and nutrients and oxygen from moving distally to it. The second thing that can happen is you can actually have an embolism. So a blood clot somewhere else in the body, like say the leg or the heart, that can then go to the brain. That's why if you watch, Jeopardy, you're always seeing those commercials for Eliquis, these blood thinning medications for people who have AFib, which is an irregularity heartbeat that can lead to blood clots in the heart that can then go to the brain. And then the third cause of an ischemic stroke is actually hypoperfusion, meaning for some reason not enough blood is actually getting to the brain, and that can be because you're really sick, you're septic, and you don't have a high blood pressure, or the arteries of your neck are all clogged up due to years of cheeseburgers and bacon grease.
Okay. All right, well, that's actually a good segue, because I was going to ask you next, what are the risk factors for stroke? And then also, sort of a two-part question, is it possible for patients or people of all ages to have a stroke?
So it is absolutely possible that patients of all ages can have strokes, even down to the 4-year-old kid. It is extremely uncommon, though, for children to have strokes and for younger individuals, younger adults to have strokes. Strokes are usually found in the older cohort of individuals due to the risk factors. Of course, weird things happen at weird times. The major risk factors for strokes would be some sort of heart irregularity, heart rhythm irregularity, like atrial fibrillation, where your heart doesn't beat normally, and the little side of your heart may not beat like it normally does, so a blood clot can form there and then break off and go to your brain. You can have something called a patent foramen which you're born with, which is a little hole in the heart that allows blood clots to kind of go where they shouldn't go. The biggest cause that is really preventable, those two things aren't so preventable. The things that are preventable, though, are the life risk factors like diabetes, smoking, obesity, diet, alcohol, lack of exercises. And the reason that those can lead to stroke is because they can create what's called atherosclerosis, clogging up of the arteries of the brain. And those lead to hypertension and hyperlipidemia, or elevated cholesterol. And those things cause the arteries of the brain to be clogged up with, for lack of a better term, gunk. And it takes years for that to happen. That's why it's usually more a disease of the older generation who have uncontrolled diabetes, uncontrolled blood pressure or cholesterol, who don't exercise or don't eat right. And it's very similar to a heart attack. This is a heart attack of the brain. It's the exact same principle, the exact same idea. One of the arteries is clogged up, not allowing blood to flow, causing that tissue to die.
Okay, very interesting. Now, of those preventable risk factors that you named, is any one of those a greater risk than the other, or are they all pretty much equivalent?
The risk factors, the life risk factors, are all pretty equivalent. I mean, blood pressure and cholesterol are probably the most major, but if you think about it, they all kind of work together. Obesity leads to hypertension and hyperlipidemia. Obesity leads to diabetes. Lack of exercise leads to obesity. Smoking itself can cause issues with the arteries in your entire body. And diet, it causes obesity, which causes elevated, so they're all kind of linked. The things that you can't really change are this hole in your heart, this PFO, patent foramen ovale, and then AFib, these arrhythmias that people just get as their heart gets older with them. Although there are new medications out, as I was referring to, that we put patients on that are called blood thinners. And these medications help thin out the blood to prevent blood clots from forming at all.
Okay. Well, thank you for this great information so far. There's a lot more information we want to discuss, but just hearing about the risk factors, alone is super important, because those are things that we can all look at. What are the risk factors? Are we at risk for stroke because of any of our behaviors or lifestyle choices? So we have a lot more questions to ask of you, Dr. Kramer, but before we do, we have to take our first break of today's show. Before we do, I want to remind our listeners how you can contact us here at our show. So we have a special Morton in the Morning radio show email address that we've set up, and we would love to hear from you if you have any feedback about any of our shows, any questions that we can answer for you on air or on a future show, or any ideas for topics that you'd like to hear about on our show in the future. Please reach out to us. Our email address is mortoninthemorning@steward.org. That is MORTON in the morning at STEWARD.org. So stick around. We'll be right back with more with Dr. Zach Kramer and talking about the topic of stroke.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. Today we have a really great show lined up for you, and it's all about the topic of stroke. We are here with our Associate Chief of Emergency Medicine, Dr. Zach Kramer, and before the break, we're learning a little bit more about what a stroke is, as well as what the risk factors are, including many preventable risk factors. And as we dive into the second segment of today's show, we're going to cover a lot more great education and information for our listeners. Now, a very important question to those listening out there. What are the signs and symptoms that someone may be having or experiencing a stroke?
And this is super important because just like a heart attack, time is of the essence. Time is brain, in other words. So it's literally tissue dying, and we need to stop that and open up those arteries. Just like if you have a heart attack, we go in and we put in a stent to open up that artery to allow blood flow to the heart before the heart dies. While we don't have that exact kind of technology for the brain yet, we're getting close. It's important to know when you have a stroke as soon as possible and go immediately to the emergency department.
Okay.
So the most common signs, I'll give you a nice little anagram.
Okay.
It's be fast. Be fast. So when you think you're having a stroke, be fast and call 911. B is balance. Very imbalance issues. So difficulty holding a cup, brushing your teeth. If something's just not right, you can't walk, for some reason you're very off balance. The E is for eyes, vision. Are you having loss of vision in one eye, in both eyes? Are you seeing double? The F is for facial droop, and it'll generally be on one side of the face. Not so like the left side is drooping, but the right side looks fine. So you generally you can ask someone to smile, and you'll literally see one side of the mouth go up and the other side won't. The A is for arm, meaning weakness or numbness. So you lift up both arms, the right arm lifts up great, but the left arm drops to the ground.
Okay.
That is very concerning. It can be arm or leg. The S is for speech, difficulty speaking, and that can be literally, I want to say something and I can't get it out. That's called aphasia. I want to say a word, but for some reason I can't get it out. or actual slurred speech.
Okay.
Both of those are concerning. And then the T in be fast is, as I said, time is of the essence. Time. It's just to remind you to call 911 as soon as possible. Any of those concerns, you call 911. Be fast. That's balance, eyes, facial droop, arm or leg weakness, speech difficulties.
Okay. Now, that's interesting because I was always familiar with the fast. Was the B added to that at some point in time, or just was it always there?
It has been recently added because you can have odd strokes, specifically with balance, that are what are called posterior strokes. They're in the cerebellum. The cerebellum is what helps give us our balance. And while they don't present with the I can't speak or I can't lift up my arm, they're just as debilitating, and they're a lot more difficult to pick up.
Okay.
And the eyes is generally, if you have an issue with the eye where it's more of a forerunner, a concerning symptom of an impending major stroke is usually what it is. So you can have a little bit of issues with your eyes and it'll go back to normal. But that's like that's your body's warning sign. Hey, something ain't right. Because what happened is probably you had a little clot that occluded the artery of your eye, or a part of the brain that gives you vision, and then it went away. It got flushed away. But it's concerning that hey, this is the big one's coming. And with any of these symptoms, you can have symptoms that maybe last 20 minutes and go away, and you could think to yourself, oh, that was just weird. That was nothing. But that might be your body's warning signal, your body telling you, hey, this is serious, and this is what's called a TIA, a transient ischemic attack, which is a mini stroke, in other words, because the deficits aren't permanent, but it's a warning sign that, hey, the big one is probably coming.
Okay. Now, someone could have multiple TIAs, correct, but they are more likely to have a larger stroke later down the road. Is that accurate?
If you have lots of TIAs, you're definitely at high risk of eventually having a major stroke.
Okay. So we talked about, time is of the essence, calling 911. Is there anything else one should do if they are witnessing a family member who appears to be having a stroke?
Honestly, just make sure that they don't choke. So if they're eating, you want to stop them from eating and try to get the food out of their mouth, because sometimes you can have difficulty swallowing, and you don't want that food to get stuck or go down the airway and occlude their airway so they can't breathe. But pretty much it's just call 911. We don't tell you to give any other medications, because what's going to happen when you come to the emergency department, the first thing we're going to do is we're going to get a CAT scan of your head. And CAT scans aren't really good at picking up the ischemic stroke, the most common stroke that we talked about. They are good at picking up hemorrhagic strokes, a brain bleed, because the treatments are very, very different. Okay. So you will immediately get a CAT scan. We make sure there's no blood. Okay. And then we get another CAT scan with contrast, looking at the arteries of your brain and of your neck to see if there's any blood clot that's clogging things up. And the reason we do that is because there's new technology out there where we can go in there, we can go in through the groin just like a cardiac catheterization to put in a stent, go up to the artery in the brain and suck out that clot. And that is new technology that has come out in the past 8 to 10 years that is revolutionizing the way that we treat strokes.
Okay. So later in the show, we're going to actually be speaking with Patrick Lofgren, who is our EMS manager here at Morton Hospital. And I want him to talk a little bit about how our EMS partners play a huge role in the treatment of stroke patients. So he'll talk a little bit about what happens, when someone's in the ambulance, etc. But let's walk through starting when the patient arrives here at Morton Hospital and we feel they might be having a stroke. So what happens?
So if you're coming in by EMS, and everyone who is very concerned about having a stroke should generally try to come in by EMS, because I don't want you driving if you can't move the left side of your body. And you'll get seen more quickly, to be totally honest. But you are met at the entrance of the emergency bay by a physician who determines whether or not immediately you are having a stroke. If you are, you go directly to CAT scan to get that CAT scan of your brain to rule out the brain bleed, the hemorrhagic stroke. If there is no blood in the brain, meaning you're not having that hemorrhagic stroke, as I explained earlier, CAT scans are not very good at picking up an acute stroke. Okay. They'll show you a stroke that happened a week later, like a week afterwards because you can see the brain death, but acutely in the moment, you can't really determine on a CAT scan if someone's having a stroke. That's what really MRIs are for.
Okay.
But it's very difficult and time consuming to get an MRI, and not all places have MRIs that readily available. So the standard of care is to get the non-contrast CAT scan, the scan of your head, and then a scan of the arteries of your brain and of your neck. And again, you're looking for a big blood clot to be there or not be there, so a perfusion deficit. So in other words, blood is not going to where it should go.
Okay.
If that is the case, that is where this new treatment has come up called endovascular retrieval, where you pretty much, as I said, it's like putting a stent into the heart for a heart attack. They go in and they suck out a big clot. Unfortunately, only about 20% of strokes fall into that category where we can use this new technology.
Okay.
Most of the strokes are little tiny strokes that don't have a big clot sitting there that we can see and just suck out. It's usually a clot that's way farther and more deep into the brain and something that we can't really get to. So if that happens, what we'll do is we will usually get our neurology team involved, where we have a big camera and a big video screen where we have a neurologist evaluate you through, electronically to determine or not if, in conjunction with the ER physician, they feel that you need this medication called TPA.
Okay, heard of that.
So TPA is a medication that is a clot busting machine. It causes any kind of clot to dissolve. But with that being said, it's the efficacy of it, how well it works, has not really been borne out in literature.
Okay.
It is, it's one of those medications that we give and hope it works. But whether it works or not is still not really fully known.
Interesting.
But what we do, the reason we don't just give it willy-nilly to everybody is because, in addition to breaking up clots, it can actually precipitate a head bleed. It can actually physically cause a head bleed.
Okay.
And that's why, and that happens anywhere between 6 to 10%, depending on what literature you're looking at. And that's a big, as we talked about, blood in the brain is not good. So it is a medication that has a bad side effect that can happen. So we don't give it willy-nilly. We give it, if we really are concerned for an acute stroke that we can't use that endovascular therapy on.
Okay. Now, I know, we've talked about time is of the essence because of the fact that, a stroke brain tissue is dying. But is it true that, you have to administer TPA if it's the appropriate treatment within a certain amount of time as well?
Absolutely. So as I said, the data, the actual, does this work or not, has not been fully teased out. But what we do know is that it does work best earlier.
Okay.
And the timing that they usually say is early as possible, but within 3 hours, sometimes within 4.5 hours. But technically, really, that sweet spot is before 3 hours of the onset of symptoms. Not the time that you decided to go to the ED, but the time the symptoms actually physically started.
Okay.
So that's why it's so important to get to the emergency department as soon as possible.
Sure. Okay. Now, say after someone has been treated for their stroke or their apparent stroke, what happens after that? I mean, are you monitoring the patient? What's the recovery like?
Yep. So if we are giving a patient TPA, we are generally then transferring them to our mothership hospital of St. Elizabeth's.
Okay.
And the reason we transfer them there is because they have neurosurgical team on site.
Okay.
And the reason you want that is, God forbid, just in case you're in that percentage that has a head bleed, you have the appropriate brain surgeon there to deal with it.
Okay.
Which we do not have in most community hospitals. I would say all community hospitals really don't have neurosurgeons. Neurosurgery is really a field for the tertiary big centers in the big cities.
Absolutely.
And then we do, our hospital, Morton Hospital, does have a connection with Rhode Island Hospital.
Okay.
We have a very good partnership with them where if you meet this criteria for this large vessel occlusion, where you have this big clot that we can see, we emergently transfer you, and we're talking within 15 minutes, to Rhode Island Hospital, and you go directly to their interventional lab, and they go in and they suck out that blood clot. And those patients are seeing tremendous improvement in their symptoms. We're talking people that can't move the entire side of their body, can't speak, that are stuck staring to the right, and then after this procedure are walking, talking, having normal lives again. Okay. So I mean, this is really exciting things that have been happening over the past 10 years with stroke treatment. Okay. And I can tell you, it's only going to get better. This new endovascular treatment, while it's only for certain types of strokes now, the data is just fantastic, and they're hoping that in the future they can use it for other types of strokes. But right now, it is kind of specifically for this large, blood clot in a certain spot.
Okay. So it sounds like we have a couple of key partnerships in place to help, care for patients. The collaboration is there. So that's obviously very, very important. I would love to ask some more questions of you right now, Dr. Kramer, but we are almost at the halfway point of today's show, which means we do have to take another break, but hopefully you'll stick around with us because I do have a few more questions for you before we move on to our second guest of today's show. So if you just joined in, we are talking with Dr. Zach Kramer, the Associate Chief of Emergency Medicine here at Morton Hospital, and we are providing some stroke education to our community. So stay with us. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the second half of today's Morton in the Morning show. We hope you have been enjoying today's show. It's all about the topic of stroke, and we are chatting with Dr. Zach Kramer, who is an emergency medicine physician here in our emergency department. And we have heard a lot of great information on many topics about stroke. What a stroke is, what are the different types. We've talked about risk factors and prevention of stroke. We've talked about the treatment of stroke. And we've also learned by Dr. Kramer that we have some key collaborations and partnerships in place with some other facilities that if needed, they can help us care for our stroke patients. For example, if a patient does require some sort of neurological surgery. So it's great that we have those partnerships in place because, again, it's all about the patient. But even so, patients, if they think they're having a stroke or a family member is, they should still come to the nearest hospital right away. They shouldn't try to go to any other, drive to a hospital that's far away. Nope.
And, we are a designated stroke center. Mm-hmm. As I was talking about our stroke committee, is we make sure that we are, sticking to the most strict national and state guidelines and the guidelines set forth by the American Heart Association. Mm-hmm. And that is actually monitored nationally. And we are indeed an accredited stroke program here. Okay. And we do a very good job, in my opinion.
Excellent. So just to sort of summarize, what is the most important thing that people need to know about strokes?
Is you need to know the signs and symptoms. Mm-hmm. Your be fast.
Yep.
Any issues with balance, any issues with vision, blurry, double vision, facial droop, arm or leg weakness or numbness, speech difficulty, either getting it out or slurred speech. And then the most important thing is get to the emergency department as soon as possible. Okay. There are a lot of strokes where people have them in the middle of the night and they wake up in the morning with those symptoms. Even though we don't know when that started, it doesn't matter. You get to the hospital as soon as possible because that time is still important.
Okay. Is there anything else our community should know about, stroke care services here at Morton?
Yes, you should know that we are open 24/7. We are willing and ready to see anyone with any ailment, especially stroke, and to get you the best and most appropriate care that you can get in a community. I'm very proud of our team here at Morton Hospital. We're a small community hospital, but we act like the big guys downtown. we're going to get you to the right spot and get you treated right and hopefully get you having a good outcome.
Great. Thank you very much. Now, a lot of great information was shared, but I know there's also a lot of great information about strokes and education online. So would you recommend the American Heart Association website? Are there others that you would recommend?
Absolutely. The AHA is probably the standard of care. They are the ones that make the guidelines. And that's probably the best place to get your information. And also, your doctor. Talk to your doctor about it. Talk to your doctor about things to help prevent strokes, like losing weight. Exactly, losing weight, eating right, exercise, stop smoking, cutting back on alcohol, taking medications to help with blood pressure and cholesterol. These are all things that can very much help prolong a good and meaningful life.
Okay. Well, actually, this show is very timely because coming up in May is actually Stroke Awareness Month. So we'll certainly be sharing some additional education then. But definitely check out those websites, talk to your doctor like Dr. Kramer said, and just know that we're here for you. So thank you, Dr. Kramer. That was a lot of great information. I learned a lot, and I'm sure our listeners did as well. So we appreciate you being here with us.
All right. Thank you guys for having me. I appreciate it.
Keep up the great work. So as we continue to talk about the topic of stroke, for the second part of today's show, we have a new guest with us, and his name is Patrick Lothgren, and he is our EMS manager here at Morton Hospital. So thank you so much for being here, Patrick. Let's start, before we get into some specific questions about stroke, tell us about yourself and your background.
Thank you, Julie. As you mentioned, I'm the EMS manager here at Morton Hospital. I've worked in emergency medical services for about 20 years, 15 of those as a paramedic. I initially worked here at Morton Hospital from 2015 to 2018. Left for a couple of years, and now I'm back and happy to be back. So I work with the local affiliate hospital medical director, who is an emergency physician here at Morton Hospital. His name is Dr. Shadi Kiriaki. Under state regulation, each fire department, EMS service, and paramedic is required to work under an emergency physician's license, and as mentioned, that is Dr. Shadi Kiriaki.
Okay, great. Well, first of all, welcome back home to Morton Hospital.
Thank you.
And then, let's get into talking a little bit more about stroke care. So earlier in the show, we were speaking with Dr. Kramer. He provided us a lot of great education, talked about prevention of stroke, and we also got into talking about what happens here at the hospital when someone who may be having a stroke arrives at the hospital. But I wanted to talk with you about a few points that we touched on. One is the importance of getting to the hospital via an ambulance versus having someone drive you or having to drive yourself. So can you talk a little bit about the importance of that?
So Julie, as I'm sure Dr. Kramer mentioned, time is of the essence with a stroke victim. Time means tissue, and the more tissue that can be saved, the better the patient's outcome. When you contact 911, and they recognize that you have stroke symptoms, they have the ability to contact the emergency department directly before you arrive at the hospital. And that affords the benefit to the hospital of clearing the CAT scan table, so you can go directly to CAT scan from the EMS stretcher. And that saves time. And as mentioned, time to diagnosis means time to treatment. There are different types of stroke, so there are different types of treatment. And that's why we need to determine what type of stroke you have before we actually determine the treatment. And that could mean transport to a different hospital other than Morton Hospital.
Okay. All right, and Dr. Kramer did reference some of the partnerships that we have in place for stroke care. Now, talking about the initiation of treatment. So what happens in the ambulance? Do the EMTs or paramedics actually start any sort of treatment while the patient is in the ambulance on the way to the hospital?
They do. So when they recognize that a patient is having a stroke-like condition, they'll do a stroke scale assessment. That stroke score is then communicated to the emergency department. They will start an intravenous line. They'll put you on a cardiac monitor so we can monitor your heart rate. And they can also do things like prepare for possible deterioration of the symptoms, such as an unstable airway. They'll prepare for intubation if needed, which is a breathing tube that they'll put into your airway. They'll prepare for potential seizures with anti-seizure medications, so on and so forth, oxygen therapy if that's needed.
Okay. Now, how do they actually alert us that they're on their way? Is there like a special system? Do they use a radio? Do they just call the emergency department and say, we're on our way with a potential stroke patient?
So traditionally, EMTs and paramedics would communicate with the emergency department through a radio system that's run by the sheriff's department, and that's called CMED. However, a few years ago, we implemented a tool here called Triage, which is a cell phone-based application that delivers more robust information to the emergency department, including pictures of the patient's EKG. There's better access to the emergency department with when they can actually start that communication. The radios are typically based in an ambulance.
Okay.
They typically would not make that radio report until they're already driving. With a stroke, this is important because with this cell phone tool, they can start that communication as soon as they recognize that that patient may be experiencing a stroke, and that can be as quickly as by the bedside in the patient's house.
Okay.
That affords the hospital more time to get that CAT scan table ready to prepare the ED physician for the arrival of that patient.
Okay, all right, great. That's really important. So when they alert us, aside from, like you mentioned, getting the CT table ready, are there any other preparations that the emergency department team are making to receive that patient?
Yes. So when EMS identifies that a patient is a potential stroke, they call that in as a stroke alert, which again is sent in through Triage. Initially, the charge nurse answers that call at the charge nurse station, and then they'll call overhead throughout the hospital a stroke alert. That prepares the stroke team for the arrival of that patient, which again, most importantly, we clear up the CAT scan department so that patient can be brought to CAT scan directly from the EMS stretcher.
Okay. Now, you mentioned a stroke team, so who might be part of that stroke team?
So the stroke team consists of nursing, emergency department techs, radiology techs, and the emergency department physician on staff at that moment.
Okay. So it sounds like there's a really great streamlined process in place just to get that patient treated as quickly as possible. And obviously EMS, as we have just learned, is a critical part of that. So Dr. Kramer and I, talked a little bit about, time is of the essence. A lot of people have a go-to hospital, but why is it important that when they get in that ambulance, the ambulance just comes to the nearest hospital instead of, their preferred hospital?
Again, as I mentioned, there's a chain of events that happens in stroke care. That first chain is identification of symptoms. The second one, and probably the most important, as I've already mentioned, is getting that patient into a CAT scan, so we can determine what kind of stroke that patient is having. There are, again, I'm sure Dr. Kramer mentioned this, but there are multiple types of stroke. Some of those strokes can actually be treated here at Morton Hospital. And surprisingly, that's actually a majority of them.
Okay, good.
They're treated with medications that dissolve a clot that may be obstructing blood to the brain. And if that delay occurs by transporting to a hospital that's further away, you're delaying the amount of time to get to that actual medication.
Right, and delaying potential treatment options possibly as well, right? So that's great. Let's thank you to our EMS partners for being such great collaborators with us and caring for our stroke patients. Now, are you also an EMT or a paramedic?
I am a paramedic.
Okay. So aside from the stroke topic, I just want to hear from you a little bit more about how you work closely with our EMS partners and what that relationship is like. What other things do we have going on in collaboration with our local EMS?
Sure. So as I mentioned, I work with Dr. Kiriaki, who's the local affiliate hospital medical director. As I mentioned, there are every fire department EMS service and paramedic in the state must work under the license of an emergency physician.
Okay.
So I work as a liaison between the medical director and multiple community departments, including Taunton, Berkeley, Lakeville, Rainham, Easton, and Dighton. I hope I didn't miss any. Middleborough.
Okay.
So I help assure that we get education distributed to the departments, that they are following the statewide treatment protocols and regulations and so on and so forth.
Okay, all right. And I know we also do a lot of educational events with EMS too, right? You're a part of many of those. I think they're called EMS rounds or EMS grand rounds?
As part of our affiliation agreement with the services, we hold an EMS rounds, which is monthly. We do case reviews, and we also discuss certain topics in regards to pre-hospital treatment of emergency patients.
Okay. And I know that you also have some great ideas for community outreach collaboration with EMS. So hopefully on our future show, we'll hear a little bit more about that. So thank you for being here and talking about the stroke care component, but also just our general relationship with EMS. They're definitely an extension of our team and the care that we provide in the community. So great that we've been able to maintain such positive relationships with all of our local EMS partners. So, Patrick, thank you for your time. We appreciate having you here, and hopefully we can have you again in the future.
Thank you for having me, Julie. And I just want to mirror what you said. A great thanks to all of the local EMS providers and services that work very hard for our communities. They do a great job, and we're happy to be partners with them.
Absolutely. Thank you so much. All right, well, it is time for us to take our final break of today's show. First, we want to thank, again, Patrick, our EMS manager, and Dr. Kramer for sharing such great information with us on the topic of stroke. And when we come back, we'll have a little bit more information for you, as well as some other hospital updates. So stick around, and hopefully you'll join us for the final segment of today's show after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone. It's Julie from Morton Hospital. Thank you for joining us for today's Morton in the Morning show. This is our final segment of today's show, and it's been a great one so far, in my opinion. Hopefully you've enjoyed listening as well. But we've been talking all about the topic of stroke, which is so important. We learned a lot from Dr. Kramer at the beginning of our show, from our emergency physicians team. He is our chair of our stroke committee, and he shared a lot of great information with us about stroke, including education about the types of strokes, the risk factors, and how treatment, the different treatment options here at Morton Hospital, and how the team collaborates to make sure that patients are receiving the right treatment as quickly as possible. So Dr. Kramer earlier mentioned that a lot of great information and education about stroke is also available on the American Heart Association website. So I wanted to give you that info so you could go online and take a look for yourself. So the website is actually, if you just type in your internet browser, you can type in stroke.org. And go to that website. It's the American Heart Association's American Stroke Association page. They are affiliated. The American Stroke Association is a division of the American Heart Association. So if you go right to stroke.org, there is so much great information about stroke. Again, more about the warning signs and that Be Fast acronym that Dr. Kramer highlighted for us. Information about stroke prevention. Also some great information about stroke recovery if you or a loved one has recently experienced a stroke. So a lot of great supportive topics and information online there. There's also a newsletter, Stroke Connection e-News, that you can sign up for, and you can read, stroke-related news, resources, and stories for survivors and caregivers. So that's another great resource that's available on that page. or you can also sign up for their Together to End Stroke newsletter, which is a more basic newsletter for anyone interested in the latest stroke news and resources. And it says that as a thank you for signing up, you'll get access to a free mini cookbook. So that's pretty exciting. And then also on this stroke.org page, so many great videos are posted with some education that you can share with your loved ones as well to help educate them on the signs and symptoms of stroke, and most importantly, the risk factors, especially those preventable ones that Dr. Kramer spoke about earlier in the show. And as I also mentioned, May coming up is Stroke Awareness Month, so it's a good reminder and a good time to start thinking about those risk factors and talking to your loved ones about stroke, and also talking to your doctor, like Dr. Kramer had mentioned. Talk to your doctor about your risk level for stroke. So talk to your doctor and check out the online resources that we shared with you today on the American Heart Association or American Stroke Association websites. Now, before we end today's show, just a few updates to give to you on some other hospital-related news. So coming up this Friday, April 9th, we are one of many sponsors for the Boys and Girls Clubs of Metro South's annual Bid for Kids Great Futures Gala and Auction. So this year the event is actually virtual, and it's always an amazing event, but one of the great things about this year's event is that it is free. So you can attend for free because it's virtual. They have a gala, a silent auction component of that event. You can also participate in a virtual cocktail reception, which is presented by Bristol County Savings Bank. And then they have a virtual program with a speaker. They do an after party hosted by Shields. They also do some awards, some community service award recipients. So it's a great event to watch. And again, they end the event with the silent auction. They have a lot of great prizes, and it's a great way to support the Boys and Girls Club. So if you want to attend, you can sign up right online. Again, it's free. If you go to the Boys and Girls Clubs of Metro South website, which is bgcmetrosouth.org. That's BGC for Boys and Girls Clubs, metrosouth.org. And you find the event, the 2021 Gala Auction. So we look forward to participating in that, and we are very honored to be one of the sponsors of this great event this year. Coming up later this month, we will be participating in Taunton Area School to Careers annual Business Education Spelling Bee, which is always a fun event. And we are building our team this year to support that great program, the Taunton Area School to Career, and also in hopes that maybe we'll take home that Spelling Bee trophy again. We actually did it back in 2019, and maybe we can become returning champions and at the same time win a nice scholarship for the student that's paired with us. So that event will also be virtual, so watch for some more information about that online or through Associates for Human Services. I'm sure they'll be posting some information so that anyone who wants to watch along can do so online. And then lastly, just an update with regard to our hospital's outpatient COVID-19 testing clinic. So this week we actually started with some updated clinic hours. Our new hours are we are doing testing Monday through Friday from 8 a.m. to 2 p.m. only, and you do have to have a provider order in order to be tested here at Morton Hospital. So again, the hours of our testing clinic are now Monday through Friday, 8 a.m. to 2 p.m. So that's a little bit of a change this week. So make sure you check out that information on our website before you come. We don't want to turn anyone away, but we are only going to be opening our clinic from 8 a.m. to 2 p.m. Monday through Friday. And we are closed on most holidays. So for the upcoming Patriots Day holiday on Monday, April 19th, our clinic will be closed for general testing. Now, you can find all of the latest information about our COVID-19 testing clinic right on our website, mortonhospital.org. If you go to the button at the top of our homepage, which says Learn More, and it has a reference to our visitor restrictions, then it will bring you to a page that has information about our current visitor guidelines and policy, as well as about our COVID testing clinic. It has, frequently asked questions, a list of alternative testing sites, and there's also some information on there just from the state with regard to COVID-19 vaccination sites and when and where you can go to get tested. So hopefully you enjoyed today's show. Again, we had a lot of great information. Stroke is such an important topic for everyone to be educated about. We look forward to joining you again next week for another new show. And just a reminder, as I mentioned earlier, we would love to hear from you and hear your suggestions about what you would like to hear about on an upcoming show. So you can reach out to us anytime at our Morton in the Morning email address, which is mortoninthemorning@steward.org. It's MORTON in the morning at STEWARD.org, and you can send any feedback, suggestions, or questions that you'd like us to answer to that email address, which we check throughout the week. All right, well, we had a great show. Thank you so much for listening. It is time for us to sign off, but we look forward to joining you again next week. So please tune in again. We're with you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. Thanks for listening, and have a happy and healthy week from all of us here at Morton Hospital. When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.